What is aplastic anemia? Aplastic anemia is a condition that occurs when your body stops producing enough new blood cells. Aplastic anemia leaves you feeling fatigued and with a higher risk of infection and uncontrolled bleeding. A rare and serious condition, aplastic anemia can develop at any age. Aplastic anemia may occur suddenly or it can occur slowly and get worse over a long period of time. Treatment for aplastic anemia may include medication, blood transfusion, or stem cell transport, also known as bone marrow transplant. What are the symptoms of aplastic anemia? Aplastic anemia symptoms may include fatigue, shortness of breath with exertion, rapid or irregular heart rate, pale skin, frequent or prolonged infection, unexplained or easy bruising, nosebleed and bleeding gum, prolonged bleeding from cuts, skin rash, dizziness, headache. Aplastic anemia can progress slowly over a week or a month, or it may come on suddenly. The illness may be brief or it may become chronic. Aplastic anemia can be very severe and even fatal. What are the causes of aplastic anemia? Aplastic anemia develops when damage occurs to your bone marrow, slowing or shutting down the production of new blood cells. Bone marrow is red, spongy material inside your bones that produces stem cells, which give rise to other cells. Stem cells in the bone marrow produces blood cell, which is known as red blood cell, white cells, and platelets. In aplastic anemia, the bone marrow is described in medical terms as aplastic anemia, meaning that it is empty aplastic or it contains very few blood cells. What are the factors that can temporarily or permanently injure bone marrow and affect blood cell production? And it include radiation and chemotherapy treatment. While these cancer fighting therapies kill cancer cells, they can also damage the healthy cells, including stem cells in the bone marrow. Aplastic anemia can be temporary side effect of these treatment. Exposure to the toxic chemicals. Exposure to the toxic chemicals such as some used in pesticide, insecticide may also cause the aplastic anemia. Exposure to the benzene as ingredient in gasoline also been linked to aplastic anemia. This type of anemia may get better on its own if you avoid repeated exposure to these chemicals that cause your initial illness. Use of certain drugs. Some medications, such as those used to treat rheumatoid arthritis and some antibiotic, can cause aplastic anemia. Autoimmune disorders. In autoimmune disorders in which your immune system begin attacking healthy cells may involve stem cells in your bone marrow. A viral infection. Viral infection that affect bone marrow may play a role in the development of aplastic anemia in some people. Viruses that have been linked to the development of aplastic anemia include hepatitis, Epstein-Barr virus, cytomegalovirus, and paravovirus B19 and HIV virus. Pregnancy. Aplastic anemia that occur in pregnancy may be related to an autoimmune problem. Your immune system may attack your bone marrow during pregnancy. Unknown factors. In many cases, doctors aren't able to identify the cause of aplastic anemia. This is also called idiopathic aplastic anemia. Confusion with myelodysplastic syndrome. Aplastic anemia can be mistaken for a condition called myelodysplastic syndrome. In this group of disorder, the bone marrow produces new blood cells, but they are deformed and underdeveloped. The bone marrow is myelodysplastic syndrome is sometimes called as hyperplastic, meaning that it is packed with blood cells. But some people with myelodysplastic syndrome have empty marrow that difficult to distinguish from aplastic anemia. Connection with other rare disorders. Some people with aplastic anemia also have rare disorder known as paroxysmal nocturnal hemoglobinuria. This disorder causes the red blood cell to break down too soon. Paroxysmal nocturnal hemoglobinuria can lead to aplastic anemia, or aplastic anemia can evolve into paroxysmal nocturnal hemoglobinuria. Okay, what are the risk factors? Aplastic anemia is rare. Factors that may increase your risk include treatment with high dose radiation or chemotherapy for cancer, exposure to toxic chemical, the use of prescription drugs such as chloramphenicol, which is used to treat bacterial infection, and gold compound used to treat rheumatoid arthritis, certain blood diseases, autoimmune disorder, and serious infection. Pregnancy really. What are the prevention? There is generally no prevention for most cases of aplastic anemia. Avoiding exposure to insecticides.